Welcome doctors. Today, let's talk about something that's shaking up the world of healthcare operations, medical coding outsourcing. Many of you are already seeing it firsthand in your hospitals and clinics. Entire coding teams are being reduced or replaced, and the work is moving overseas. I recently came across a coder who said they've had a big system merge after the backlog was cleared with contract coders from India. The hospital decided to outsource coding permanently. A group of billers and coders were just let go. And that's not an isolated story. Across the country, coding departments are facing the same reality. Which raises the question, is this the new normal? Are hospitals and insurance companies outsourcing medical coding simply because it's cheaper? Many experienced professionals say they've seen this cycle before. First, the work goes overseas to save money. Then quality problems pile up, backlogged edits, poor documentation, even ridiculous errors like coding hemorrhoids as a primary diagnosis for a patient who died from respiratory failure. Eventually, management brings the work back in-house to clean up the mess. Lather, rinse, repeat. But not everyone believes it's cyclical anymore. Some say big hospitals and payers aren't bringing it back. In fact, they're expanding outsourcing. And if you look at the financial side, it's easy to understand why. Overseas coders may earn $300 to $500 a month, compared to $2,000 or more per paycheck in the US. If you were running a hospital under constant cost pressure, what would you do? That said, quality is still the big concern. Experienced auditors reviewing outsourced work describe major accuracy problems, especially with complex coding like surgeries. Yet, management often doesn't care, as long as charts move fast and costs stay down. And then there are privacy concerns. Doctors are asking, what about HIPAA? What happens if there's a data breach overseas? Patients might not realize that their private health information, full name, social security number, even detailed visit notes, is being sent halfway across the world. Imagine how uncomfortable many would be if they knew. So what does this mean for us? The truth is, outsourcing isn't going away. In fact, it's growing. But the smarter organizations are choosing a different model: dedicated virtual coding teams. Instead of mass outsourcing with high turnover, they assign specialized healthcare trained coders, sometimes even doctors, nurses, specific practices. These coders become familiar with provider preferences, clinical workflows, and specialty specific coding, while still keeping costs far below domestic staff. The key difference is quality oversight. HIPAA compliance, SOC 2, ISO 27001, all baked into the process. Dedicated coders working with one practice, not a rotating pool of contractors. That's how you avoid the hot mess cycle that so many of us have seen play out. And the cost structure is hard to ignore. While a US-based coder might cost $4,500 to $6,000 a month including benefits, a virtual specialist often costs under $2,000 a month. For many hospitals and clinics, that's the only way to keep revenue cycle operations sustainable. Here's what it comes down to: outsourcing is no longer optional. It's becoming part of the DNA of healthcare operations. The real question is whether your organization chooses the cheapest, mass market version that invites problems, specialized virtual team that balances cost savings with accuracy and compliance. So doctors, as this shift continues, we need to stay informed and engaged, because whether we like it or not, outsourcing is shaping the future of medical coding, billing, and revenue cycle management. The challenge is making sure patient care and data security aren't sacrificed in the process. Thanks for joining me today. If you found this useful, share it with a colleague who's watching these same changes unfold. And remember, the way we handle outsourcing now will shape the quality and stability of healthcare for years to come.